Dr. Warren Umstattd.
Thank you guys for inviting me. It was a little bit of a surreal moment when I got the email. So good morning, everybody, graduates, faculty, families. To the class of 2025, you made it. You're now physicians, you're doctors, clinicians, you're thinkers, and you're gonna be leaders. I want you to just take a minute and savor this moment. Big inhale with me. Breathe it in, because you deserve it. I'm a Mizzou Med grad, I'm a facial plastic surgeon and a mom of 2 incredible boys. I built my practice from literally nothing, and I have a habit of doing things very differently. I'm here to talk to you today about what happens when you stop following the rules and start writing your own. I built a career I love, and I'm here today because I asked better questions. I want to encourage every single one of you to push back, to choose differently, and to have the audacity to imagine more for your career. But before you get there, you have to make it through residency. It's gonna be really hard. I would consider it brutal, but you're gonna be humbled, you're gonna be exhausted, you will work past the point of depletion. You will cry in the stairwell. You will feel like throwing your pager or your phone in the toilet. You'll doubt yourself on call. You'll stare at a computer monitor and wonder if you're cut out for any of it. But let me assure you, that does not mean you're failing. It means that you're becoming.
Good.
Residency is a lot. It's a lot to soak in. Be curious. Ask every single question, get there early, leave late. Don't just check boxes and memorize protocols. Chase the questions that keep you up at night. Think about the patients that perplex you. Push deeper, learn and truly understand. In clinic, ask why. In the operating room, lock in. Every moment that you see your attending making a move, figure out why they're doing that. Learn from everyone, your attendings, your co-residents, the RTs, the NPs, the PAs, the pharmacists, and most importantly, the nurses. You will learn more from the nurses than some of your attendings if you allow them to teach you. Every moment, every mistake, every win, every loss, it's yours to learn from. And while you're learning, you're going to be told to toughen up, pay your dues, wait your turn. You'll start to think that that's what medicine really is. But let me tell you something, residency is not the final form. It's a bridge to your future career, a necessary one, but it's not the final form. It is the crucible, the grind that will sharpen you into the physician that you're going to become. So yes, show up, be diligent, be a sponge and be hungry, but also start dreaming about your future career. I want you to start dreaming now, not 5 years from now, not after fellowship, not once you're established or allowed to dream. I want you to start dreaming today. Start envisioning the life that you actually want, the career that lights you up, the job, the calling. What does that look like to you? Really think about it and hold it in your mind tonight when you're soaking this all in. And I want you to start laying the bricks in that direction. Because here's what they don't tell you. The system will dictate your moves and shape you into what it wants you to be. It's going to hand you a script, shove a ladder in front of you, and try to convince you that success is assimilation. But you don't have to fit in. I didn't follow the script. I didn't become the doctor I was supposed to. Work for a big hospital, round in the morning, in the OR all day, bill, defer to the other guy in the room, dress neutral, not speak up. Instead, I wrote my own script, and that's why I'm here today, exactly 10 years to the day for my own graduation. I ended up leaving my fellowship early. I bought a piece of land. I built my dream. I created a brand I love. I hired my own team of amazing women. And I take care of patients exactly how I feel like they should be taken care of. I became the type of doctor that medicine didn't ask me to, but that it needed to. The script that you're going to be handed after residency, the one where you grind and comply and sacrifice your humanity, that script is broken. And if you don't wake up, medicine will break you. So I'm here to give you a new playbook, or at least the permission to write your own. Rule number 1, protect yourself. Not just your body, but your mind, your curiosity and your joy. You've spent the last 4 years here learning how to protect patients, but no one has taught you how to protect yourself. No one gave you the tools to fend off burnout, to stand firm against the bureaucracy of medicine, to shield yourself from the emotional erosion of constantly being told that you are not enough. Don't wait until you're bitter to set boundaries. Protect your joy. Protect your weekends. Protect your relationships. Protect your peace like it's a sterile field. Rule number 2, I want you to choose yourself first. You're going to be asked implicitly and explicitly to put every single person ahead of you. Your patients, your partners, your boss, your inbox. You'll be praised for doing that. You'll be celebrated for being selfless. You'll be called a team player. But here's the truth. If you abandon yourself to serve others, you eventually have nothing left to give. And you can't pour from an empty vessel. Choosing yourself first isn't selfish, it's sustainable. Rule number 3, I want you to be loud when they want you to be silent. You're going to walk into rooms where no one expects you to lead. You'll sit in meetings where your ideas are considered cute until someone louder or older says the same thing. You'll watch mediocrity get promoted because it has a beard and a golf handicap. I want you to speak anyway, lead anyway. You don't owe anyone silence because they're uncomfortable with your confidence. Be so good and unapologetically yourself that no one forgets your name, especially the ones who don't want to hear it. Rule number 4, build the career that you actually want. Not the one that your program pushes you towards, not the one that your mom brags about at her book club, the one that lights you up and scares you a little bit, the one that makes you feel like you're creating something and taking care of patients how it really matters. Do you want to be a trauma surgeon and a mom of 3? Do it. Do you want to win Internist of the Year and write sci-fi novels at night? Do it. Do you want to write, teach, innovate, disrupt, and lead? I want you to do it. You are allowed to be more than what they taught you here the last 4 years. Medicine is a foundation moving forward. It is not a cage. And if someone tells you that you're wasting your degree, smile and go waste it in peace. With the freedom, the autonomy, and the life that you don't need a vacation from. Good. Rule number 5, learn the game and play it your way. Medicine is a system, a machine. It has rules and gatekeepers and politics. I want you to learn them. Study the hierarchy and know who's in the room. During residency, that's your time to pay attention to this machine. Ask questions, take notes, watch where that power lives, and then use what you've learned to disrupt the system and make it better. Don't just survive. Don't just work within the confines of the system. Transform it. We don't need more passive physicians who are just going to comply and check the boxes. We need provocateurs. We need architects of a better system. We need you guys, each and every one of you. The final rule is find your people and keep them close. Medicine can be very lonely. and no one gets a medal for doing it alone. When you find your people who really see you and know you and love you, hang on to them really tight. Text them when you feel down. Call them when imposter syndrome shows up uninvited. Celebrate each other's wins like they're all your own. The journey can be way too hard to walk alone. Find the ones who remind you who you are when you start to forget. Keep them close. The lone wolf Dr. trope is outdated and dangerous. We were meant to run and heal in packs. So here you are. Today feels very much like a finish line, but really it's just the beginning. You've got a degree in one hand, or in the mail, probably, and you've got expectations on your shoulders, and now you have a choice. You can follow the script that medicine gives you, or you can write your own. You can stay safe and quiet, or you can rattle the cage. You can survive in medicine, or you can build a version where you actually thrive. It won't be easy. You'll fall. I've fallen a million times, but you just get back up. You'll piss someone off by being exactly who you are. And if you're bold enough to take the risk, I promise it's going to be worth it. So go and defy the system. Shake things up. Medicine needs you, the real you. Congratulations, doctors. Let's go make some noise.